that the role of the CIO has changed totally. You know, we were software developers and architects, and we could tell you what RAM to use based on its transactional speed. Do you think any of that matters anymore? The answer is no.
Welcome to This Week in Health IT, where we discuss the news, information, and emerging thought with leaders from across the healthcare industry. My name is Bill Russell, recovering healthcare CIO, writer, and advisor with the previously mentioned Health Lyrics. I was the CIO for a 23,000-person health system, and one of the biggest challenges was to remain current on the technology and the trends that were going on myself.
Think of artificial intelligence as a orchestra. Right now, machine learning, deep learning is getting a lot of attention, so I sort of equate that to the string section. And obviously there are many sections to the orchestra, so someday soon, hospitals, healthcare organizations are going to be able to have amazing music.
We are seeing instances of folks popping up, us included, where we're having a primary care physician set up with the dentist in the same office.
I would love to get to the space where eventually we're using voice recognition to do all of our navigation throughout the electronic health record.
When we worked at Microsoft, oftentimes, you'd have crazy deadlines. People would say, look, we're not saving anyone's life here. We can't say that anymore. And we love that. It's like we can save someone's life. We can prevent a complication or a readmission by catching it.
A lot of the feedback people are hearing about former Vice President's remarks is that he was remarkably pragmatic. And then the one that I'm most excited about, he notes that the Medicare Innovation Center, which was created by the Affordable Care Act, has the legal authority to experiment with new models to engage patients for purposes of getting better valued care.
Hyper-consumerism driving everything to a digital experience, because if we don't make it easy for patients like ourselves to use healthcare on our smart devices, companies like Apple are starting to do it for us.
I think we're right on the cusp of a huge digital transformation. It'll be interesting to see how CIOs sort of address that. There we go. All right, so why don't you introduce yourself and give us the scale and scope of your organization, and then we'll go into the questions.
Well, thank you. I'm Andrew Rosenberg. I'm the Chief Information Officer for Michigan Medicine, which is the University of Michigan Health System and the University of Michigan Medical School. The health system now is about a $4.5 billion in revenue health system. Our enterprise IT is about 900 staff. We are predominantly in Southeast Michigan, but perhaps a distinguishing feature is because we are the state university tertiary quaternary care center, we get patients from every county in the state, and we're even written into the Constitution of the state of Michigan. And so we have not only a public university culture and mentality, but really, without it hopefully sounding like a platitude, we affiliate with many other health systems in the state of Michigan, and it's those affiliations that really add value, but also these interesting challenges. My personal background: I'm an internist, I'm an anesthesiologist and intensivist, and I'm a faculty at the University of Michigan Medical School.
Yeah, it's amazing. I mean, you just got done speaking here at the Becker's conference, and you were talking about just those partnerships and those, partnering with Trinity, which is a competitor in your backyard, and just about everybody in that market will use your services in some way. You're almost like a children's hospital in that it's sort of like Switzerland. Everybody sort of
right,
partners.
and of course we have the Mott Children's Hospital. But even for example, we just literally last week opened up a health cyber security operations center, our HSOC, and we're partnering with Beaumont Health. We're partnering with Munson. We're partnering with other traditional. They're not necessarily competitors, but they're what you might initially think of as competitors. It's this affiliation that we're doing that's really part of our culture.
And cybersecurity is such great. I'm getting into an interview here, and I don't want to do it. So first 5 questions. Let's just go through them real quick. So, how is your system thinking about digital and addressing digital in healthcare right now?
I don't want to sound like a contrarian on that, but I try to change that question just a little bit. What I'm really trying to say is, where are our varieties of strategies either completely now being done through digital platforms, methods, transformation, or could be done better, so that we don't have a digital strategy. We don't have a digital strategy officer. We don't have a cloud strategy. It's really recognizing how this move from analog or previous or legacy into a new way, particularly where digital will play into it, is aligned to the strategy and not a digital strategy. And I'm trying to distinguish that.
Right.
Because I think it aligns more with other leaders who don't typically think in terms of technology and IT or digital, not feel like they're somehow being sold a bill of goods.
Right. And so when you think about removing the friction from transactions, when you think about improving quality outcomes through data and those kind of things, you don't have a digital strategy per se, but you will bring digital tools to bear on those things.
Let me give you two examples that to me are superb, and they're extremely recent in the last 2 years. The first was, I wanted to promote much more advanced analytics, and I particularly wanted to promote varieties of machine learning. So we picked two vendors, one in one in supervised machine learning and another in unsupervised machine learning. It's advanced analytics, it's machine learning, but it's two particular types trying to go after two or a multitude of use cases. The one that I thought was going to work out was the unstructured form of machine learning, with the idea that it would generate hypotheses that were previously not appreciated. The one that really worked out was structured, because for a variety of different users, the ability to speed up algorithm development, which they were already working on, was significantly improved. So there was an example of trying to improve our clinical design initiative, quality, some basic discovery, and some clinical trials areas in our ecosystem. It was structured machine learning and one particular vendor that really took off. Another one now is in robotic process automation. Again, it's not that we have a digital strategy for rev cycle back end. It's we have a series of efforts and needs that fit into strategy or tactics, but explicitly looking for not just digital but specific elements that we know are likely to work. And then the final point, I'm actually using the RPA work, the robotic process automation, for invoice management and rev cycle to really try to promote real AI. So I actually, in my mind, have more of a digital strategy as the CIO. But I'm using these more pragmatic areas and other areas of the institution that will drive their value. But in the end, I'm going to pull it back up and say, see, this is how digital and digital transformation works.
Yeah. It's interesting. I'm wondering how much your culture is influenced by the university. Having the university right there keeps you, the pool's constantly moving, the pond's constantly moving. So you may not be battling a stagnant culture as much as other organizations are. And so they're saying, hey, we have to bring in these digital players from outside the industry to sort of shake things up. But with a university, you might keep things going.
I think that's true. I think that's a really insightful idea. And what I would say, though, is, and I use this example a lot. When we had a couple of very large vendors come and talk to us about analytics, they typically went right to predictive and prescriptive analytics of a variety of types. And I would say, both sincerely, but somewhat to be provocative, just real-time data would actually have more value right now than anything into predictive and prescriptive. And people would do what you're doing right now. They would smile, because I think they have been thinking about that and get it. It's not that we don't want to be planning. And that's why rev cycle, when I went to some of our other meetings, I would ask other industries, where are you seeing more advanced analytics really having value? And they would talk about a lot of the back-end, logistic, unsexy kind of stuff. But I think even for areas where the culture is a little bit more stagnant, people will get this idea because I'm not trying to pitch to the CFO something, arbitrage and global international markets. I'm saying we just want to speed up invoice management.
Right.
They get that.
Yeah, absolutely. So second question here is, how do you determine the signal from the noise? I mean, there's a lot. You come off speaking on a podium and 10 people will hand you a card. And, one of those is probably phenomenal and 9 might not be appropriate, be it timing or whatever for your situation. How did your organization sort of sift through that to determine, hey, that's a problem we want to solve?
When I created this new system-level CIO job and I was talking with the combined leadership group, I said to them the first order of business after just getting to know each other well will be portfolio management. And I'm going to get to answering your question in 1 second. In portfolio management, the demand portfolio, the project portfolio, and the asset portfolios, one of the key things that I said we have to be able to do is that this will help us prioritize those areas of a very complex organization, which, by the way, I don't think in many ways is that much more complex than many others, in order to then say what are our really true key priorities. And once we started to get better at that, then when I hear different inputs, pitches, talks, reading things, the things that tend to look like they may align to those things that I know are of priority start to stand out. They start to emerge like a color image in the background of a black and white. So an example would be knowing that analytics is extremely important to all of us, but making a point that I want to look at either real time or some extremely unsexy but pragmatic types of analytics in some of our back-end work. When people come to me and start talking about workflow redesign for robotic process automation, that will capture my attention, frankly, more than the big moonshots of neural network-enabled proscriptive analytics. I don't want to not be involved in that. But for right now, I am going to be much more pragmatic, much more aligned with some of these. But it's part of a portfolio that we've developed.
Yeah.
That helps.
Yeah, that's...
It helps to reduce what I call the shiny ball. Because I'm as susceptible as anyone else to, ooh, that sounds really cool. Or I know this person, so I want to get to talk to them or whomever. It helps.
I get it. I was on a panel once and they asked me, it's like, which one of these technologies is most attractive to you? I'm like, all of them.
Yeah, right. Sure.
I mean, that's who I am. So,
yeah.
But yes. So third thing, so you're going to be talking to a lot of CIOs with this question. So, and I have a really good cross section of CIOs. Children's hospitals, small, large, those kind of things. But one of the questions I get a lot is, what's the one opportunity that's sort of sitting there for IT that they just need to grab? And what I hear you saying is there's so many pragmatic opportunities right in front of them that they don't need to worry about the crazy blockchain or this or that. I mean, there's just basic things right there.
What I thought about before, and somehow it seems to be working out really well, and it may have been part of my clinical background, particularly where I would be in the ICU faced with a number of complex inputs. Why is this patient in the ICU? Well, there are actually at least 2 or 3 reasons that are all pretty close. You have to pick one. And this is something I developed over time, and I taught fellows and residents that even in these extremely complex situations, you still have to ground these decisions and these conversations into at least one of them. So I just say that because you said it perfectly before. Of course, the answer is that there isn't one. And so what I start by saying is, okay, in your organization, if you can at least try to say, what are your 2 or 3 top priorities, which is in and of itself already very difficult.
Well, but when you say physician satisfaction with the EMR, so personalizing the EHR, taking that on, getting them from working 12 hours a day back down to 10 hours a day would be wonderful. Or the digital consumer, or aren't there like at least a couple of things that sort of bubble up every year that are just?
Well, it's not. They're not a couple of things. There are literally dozens and dozens.
Yeah.
So that's why, again, I go back to this idea of portfolio management. But let me give you an example. One of my colleagues would talk about, we need a cloud strategy, sort of back to one of your earlier questions. And what I'd say is, we certainly don't need a cloud strategy. We need to know how already cloud, which is already deeply embedded, is going to be somewhat controlled as we go forward. So within that, just within that topic alone, the priority I picked was to work to get enterprise-level contracts with the 3 big cloud providers that we have to work with at U of M, that we want to work with, so that dozens, if not hundreds of people could benefit in their variety of innovations in the cloud. So I didn't worry about a single cloud provider. I didn't worry actually even about a single use case. From my perspective, I thought the force multiplier, it's a term we used to use in the Navy and the military, is to find what is that commonality among a variety of other uses. Yeah. And that would be one. So for me, if you said, what was the biggest thing you did in cloud? I'd say we used the size of U of M to get best contracting for the big 3 for a variety of people to now use.
Yeah. Cloud's interesting because it's the core of my business, and we go in and say, you got to set up a framework. Yeah. For me, it was, I got a phone call within the first 6 months of being the CIO. They go, hey, this is blah, blah, blah from Dropbox. Congratulations, you're one of our biggest users. I'm like, well, wait a minute. We don't have a contract with you? It's just... Right. And so they're going to use it. So putting that framework in place, putting the contracts in place, putting the security architecture and how we're going to audit and secure the data, gave people the ability to now say, okay, can we solve this problem with some cloud technologies that are out there? And we have a framework for engaging cloud providers and those kind of things.
And I could use dozens of examples of that, but one that I love was we put together a market map. I don't know if you're familiar with these, but you'll see these with VC and private equity firms. They'll show a variety of the vendors in particular spaces. And I showed it to the president of the university. And he said, wow. And what I showed him were all of the cloud vendors currently being used at U of M. And he said, wow. And there were about 130 on this one 8x11 diagram. And then I said, and that's only 4 of our 19 schools. And then he really said, wow. And I said, the point is, cloud is deeply here. Now the question becomes, what are the problems? One of which would be, how do we try to shepherd people to be using these in a more secure manner? How do we, on the other hand, shepherd people to be using these in a cost-effective manner, because otherwise they would just chew through their money using cloud if they don't do it right. Things like that.
Yeah, so you have distributed budgeting somewhat, I would assume.
Yeah.
That's interesting. 4th question. What's the biggest threat to traditional healthcare?
Cybersecurity.
Okay.
Immediately. Yeah. I didn't even need you to finish. And the reason I say this is that as a clinician, one of the threats that I would have talked about would be things that were on the medical side. Pandemic flu. Another one I would have picked probably would be the financial system itself, and we could go off on that forever.
Models. But here's my question for you on cybersecurity, because I was on a cyber panel this morning, and one of the points I made was we haven't seen a correlation between breach and it affecting the business yet. Now, clearly there's fines and those kind of things, but you don't see a mass exodus of patients.
Correct. But that's not what I'm worried about. I'll tell you, I'm worried about something that's a little bit more existential.
So you're not worried about the reputation and the...
No.
Okay. So,
I'm not.
Okay.
And because of exactly what you just said, whether it's Anthem, whether it was UCLA's breach, whether it was, we could just kind of keep going down.
Yeah, I'm still going to go to University of Michigan because it has the best care.
And I would say I would say there are a few other social factors going on, but this is my best crystal balling. Number one, as the population migrates, more and more of our population will just be that much more comfortable with their data being public. Number one. Our kids are all living in a world of infinite more public data than we ever did before. So I would say just trying to look even 10 years into the future, let alone beyond, I think people will be much more comfortable with their data. Interestingly, I think it'll be dichotomous. They'll be both more comfortable and they'll be more attuned to when it's being misused. But even if I'm wrong on that one, look at the breaches that have occurred now, some of which have been because of really just almost neglectful attention. Even that, whether it's a smaller physician office or a large, you don't see patients, I think, leaving en masse. I don't think, and I don't know this as well, do you see people leaving some of the large corporations when their data have been misused and there's been a breach of a violation of the ethics around their data? So that's at least one reason. But more importantly to me is look at some of the attacks that have occurred, like WannaCry, NotPetya, a destructive attack, not a ransomware, but a destructive attack. We were down for over a week when one vendor was attacked that was not us. We just assumed that, of course, they had good business continuity and resilience. And that just took out our transcription services. You know, who would think, well, because we couldn't then deliver notes effectively. So I'm concerned when, and my point is it's not just within healthcare, it's with all the things that are related around it, power, of course, and other social services that are required for supply chain. The ability and the examples that are real world, these are not just theoretical. To me, NotPetya is still probably the single best example that we're not discussing, where multiple organizations, Maersk Shipping, others, they were down for days. And then, of course, there were actual hospitals in the UK and others with Petya, with WannaCry, and even NotPetya that were taken out. And the speed with which it happened is much faster. I'm going to try to kill this one mosquito so that we all don't get Zika. Oh my God. This mosquito is destined to live. All right, I got it. Sorry about that. You're gonna have to get that one out of the recording.
Coming out there, it's like,
I'm not gonna let someone get.
I'm gonna care and protect you. I appreciate it.
These are existential threats that the only other thing I could think of in healthcare tended to be the epidemic. But so far, even Ebola. Think about Ebola in the United States. How many patients were actually affected by Ebola when we were all worried about that? 1, 2?
Well, that's what I was going to say. It was less than 10, right? But it was multiple markets. I mean, we saw it in Texas. We saw it in, just where people visited. So you saw it up in Ohio.
But it was literally a handful
small.
At most.
Yeah.
Only one of these big cyber attacks have affected millions of people. And for what reason, I'm not quite sure, we tend to still not be as worried about it. So that's why I jumped on that right away.
Yeah, that's interesting. It is one of those areas that I think there's so much commonality. We can partner. And we did. In our market, we did. We would sit around a table and in our market and talk about what are you doing in cybersecurity, because it's not an area of differentiation.
Correct.
And we can
in fact, not only that, but it's a great example where I think everyone I've talked to immediately gets that only through cooperation are we. It's one of the better examples where actually working together we will be better off.
Yep.
We literally only started our health SOC this week. So with all these discussions, we at the University of Michigan have only started it a week ago. We only have had our CISO for 2 years. These are still, extraordinarily at the beginning of something. And as we get more and more digitized, as well as the rest of our infrastructure is digitized, I'm really spending a lot more time with that lever than the previous one, which was financial. I mean, as a CIO, you recognize probably the lever you had to deal with more than efficiencies and interoperability and reliability maybe. I'm finding security is a much stronger lever now than even some of the financial.
That's interesting. So last question. If you could rewind the clock, and we'll play one of these games, if you could rewind the clock 3 years, what do you wish you had spent more time on 3 years ago to prepare your IT organization for today?
What's fun about this?
You already talked about it.
I've talked about a few of these, but I'll talk about one other one that we've not mentioned. And I'll just preface this by saying something you've already mentioned. What's very interesting about this work, and I can tell you, compared to even the clinical side of healthcare, the number of choices, opportunities, and things that we talk about that are new are demonstrably more than any individual person you would talk to in a clinical field. They just are. So I say that because one other one that we've not talked about, if I could do it a little bit better even 3 years ago, it would be procurement. It would be IT contracting, procurement, and all the workflow and underlying systems around how do we procure, have more efficient contracting. And also, another one would be inventories. So what I mean by that would be we just finished an enormous device inventory. It took us about 2.5 years. We spent millions inventorying all devices that connect to our network. And now we have, with network access control, the ability to also better control it. We have no inventory of our applications other than knowing that we probably have about 15 to 1,800 applications live in our environment. So inventory, application, and other type of lifecycle management, and then the procurement attachment to it will help us free up resources for the new things, because now increasingly we are just trying to find enough money to manage run. We really don't have these opportunities for grow and transform as much as we would want, because we're spending that much more supporting our run rate. If we were better in our contracting, procurement, lifecycle management, I think we could be more precise to start to carve out more money for grow and transform.
It's interesting. I've heard so many interesting answers on that. But agility seems to be, hyper-efficiency and agility seems to be the commonality of people saying, I wish I could do more today than I'm able to do, because there's so many things coming at us, so many things to do.
Right.
And if I had a more agile system, I'd be able to provision servers in a couple hours instead of a couple of weeks. I'd be able to scale up and scale down. I'd be able to move all that work that's pocket protector kind of stuff. And my dad grew up with a pocket protector, but just move that all to just run rate kind of stuff that's handled by far fewer people.
Right.
And your people are spending a lot more time with the clinicians rounding and really solving higher level problems.
Right, and when I think about that point you just made, we could talk, I could have said, we're going to invest in DevOps.
Yeah.
We're going to invest in fabric data centers, whatever. I'm trying to find, again, like I talked about with portfolio management, these commonalities, and that's why I chose this idea of contracting and procurement, because I think that's still where there is enough inefficiencies. We can find that much more money, resources. I think it also might help to also do what we all talk about doing, but I haven't met anyone, including me, who's done it well, which would be how do you deprecate legacy that's not really that helpful anymore? Right. We all talk about it, but it's a lot harder to clean your garage. It's a lot harder to get rid of some of these small applications that just keep running. And it's that process that I'm working on next.
It's interesting. I was talking to an AI company, so AI machine learning, and that's where they started. I said, well, how's the business going? They go, good. We're not doing what we started to do. I said, well, what are you doing? They go, legacy. He said, we have this massive back-end infrastructure, and people were like, hey, can you just take our old applications, move that in, create a nice front end that we can get the data back out? I said, well, yeah, we can do that. That's our core business. Like, yeah, but that's what we need. And I'm like, well, how much? They're like, 90% of their business now is that.
Yeah.
And I'm like, well, that's a need. I mean, you found that need. So,
yeah.
Hey, thank you very much.
Sure.
I appreciate
Absolutely.
Appreciate
My
the time.
pleasure, Bill.